Good evening, everyone, and welcome. My name is Richard Page, and we're going to have a great dialogue this evening. And we have with us today Dr. Nola Ishmael, mentor and motivational speaker. Good evening, Dr. Nola Ishmael. How are you?
Good evening, Rudy. I'm good. How are you?
Excellent, excellent. Doing my best, doing my best. So great to see you.
Thank you.
It's been a while.
Sure has, yes.
So Dr. Nola Ishmael, mentor and motivational speaker, is among the foremost 21st century nurse servant leaders from the Windrush generation. Dr. Nola Ishmael has a proven track record of achievement in ministerial and senior leadership roles within the NHS, Royal Colleges, public health systems, support for voluntary organisations and charities, and particularly within the NHS system, staff development, system transformation, organisational policies and procedures. And this dialogue is really going to be about, and there's three parts. This is just part one, just to introduce Dr. Nola to everybody. So our focus will be around strategies for overcoming corporate and professional challenges and boosting collaboration, trust, and cooperation. So, Dr. Nola.
Yes, so it's a big slice of dialogue that you're describing. We can do it. We can do it.
We will start at the beginning. So tell us a bit about yourself and family background, and then please describe your journey.
Thank you. I'm one of 8 children born in Barbados. I came to England when they were recruiting nurses and asking us to come and join the NHS. It was only 15 years old at the time. So I arrived in England and worked as a student nurse to take my state registration to completion. It wasn't easy. We were all just teenagers, just out of teenagers, first time traveling abroad, having to cope with things like strange foods, fog, strange ways of doing things. But we buckled down to the task ahead. Our objectives were to study hard and pass our exams first time. We took pictures and sent back to our parents so they could see us in our different shades of uniform as the years rolled on. So from student nurse, we progressed. Qualified, I then went on to work as a staff nurse. And my first staff nurse post was at the Maudsley Hospital in London. That was quite an achievement because I hadn't done mental health, but the job offered scope for development. And so I got my first manager's post there at the hospital. Over the years, I went on to study to become a health visitor, again in Southwark, where the challenges were very much as we see them today. Housing, single parents, and children with ambition who wanted to learn and do well, but needed help. Parents who were stretching money, and those who couldn't get in assistance and help. So from health visiting, we learned about how society treats the poor and what happens. And as a health visitor, let me tell you, when you hear a mother saying to you that she has to choose between washing powder and bread, what has changed today? Not that much. And so from health visiting, although I enjoyed it, when my health visiting boss was retiring, she suggested that I should apply for her job. What a surprise.
Mhm.
I did, and I got it.
Okay.
My feet were on the second rung, going up the ladder, the career ladder. They were challenging times. I got the job, but I didn't know the management side of nursing, so I had to learn that very quickly. In nursing, you have to be clinically sound. You have to know what you're doing and how to keep patients safe. And unless somebody helps you to understand the next stage of management, you may apply the wrong approach to it. So learning management was my next task, and I took to it. I understood it. I didn't want to do anything unless I had the evidence to support it. I worked with my colleagues. I ensured that students had good experiences. And so I went on working in Southern as a manager. Over the years, I saw a job advertised in Greenwich for an assistant director of nursing. This was in the late 80s. There were no Black directors. There were none of us at the top of the line, at the top of the rung. And so there was changes going on in the NHS. The Griffiths report of the 80s had just been published, and the NHS was moving from clinical leadership to business leadership, to management. And so I applied for a job at Greenwich. And behold, I got it. I didn't know I could do what I said I wanted to do, but when I got the job description from the management at Greenwich, one of the things I did was take a highlighter. I highlighted the areas that I knew and understood. And the ones that were left unhighlighted, I made sure that I had the right information to answer any questions at the interview. Having got that job, nobody had written me a handbook and said, this is what you do as a Black manager or Black assistant director. I set about working with my staff. And one of the things that I was particularly interested in was the collection of data. How do people count what they do? And so some of the initiatives I introduced was collecting data and applying it to what had gone on so that you could improve the next line of work. And I worked in Greenwich from 1987 to 1994. Greenwich was a good training ground for me. I understood about policies. I introduced new policies. And in fact, I was enjoying every day of my job. I had 2 personal assistants, a parking space, and a big office. However, one day I got a call from the Department of Health, and the caller said to me, we would like you to come and do a secondment. And I said, leave it with me for an hour and I'll come back to you. Notice I didn't say, oh, wonderful, thank you, yes, no. I then went down to my boss's office, not my boss, his boss. And I said, I've just been asked to come and do a secondment at the department. This gentleman said, that's lovely, Nola, that's a good career move. And I said, ever the one to think about the future? Will I have my job when I come back? And he said, as long as I'm here, you will. I didn't like that much, but I took it. I then went to my boss and I said, the Department of Health has asked me to come in and do a secondment. And he said, you can't go. And I said, your boss said I can. Strategy. So he said, you went to meet my boss before you came to me. And I said to him, strategy, dear boy, strategy.
Excellent.
And thus I went to the Department of Health, where everything was new and different. Civil servants can write a job. They can even tell you how you should do a job. And hardly any of them has ever worked in the NHS.
That's right.
But they're the experts.
As they say, we deal with policy.
Yes. My time at the department, I was asked to do 6 months under secondment. Before the end of that first 6 months, I was asked to say second 6 months, bring it to a year. By the end of that year, I was asked to be the professional private secretary to the Chief Nurse of England. Once again, there was no handbook for me to consult. What do you do? And I knew I had to make her look good, do logistics to get her to places on time, make sure that anything she said to the ministers was right and true, never perhaps or probable. In other words, the facts had to support my answers.
Clarity.
Yes. So I went to the Department of Health for 6 months and stayed for 10 years. And that's where I met you, Rudy.
Absolutely. And just touching on what you've just spoken about, and within the system, we talk about clarity, consistency within the process.
Yes. So my time at the Department of Health was a very good and developing time. Black nurses didn't get the chance to work at that level. I was considered a bit of a fluke. I had to say to people, this was no fluke. This was midnight oil and early morning toil. You had to be up with the birds, knowing your facts. And if someone called you on a Saturday morning, goodbye to the shopping and whatever you're going to do, you had to find that answer, even though offices were closed. You had to be diligent, and you had to build a reputation that people would take your calls. If they hear you're on the phone, it must mean something. There was no frivolity. And what's more, the courtesies had to be extended. Would I have changed it? Not for a second. All this was growth and development. My jobs, both in the NHS and the department, was challenging. I had to work through some of the petty thinking when people say, how did you get here? How did you do what you do? I facetiously said slowly, steadfastly. But to be serious, it meant reading to an extraordinary degree. We didn't have computers of the level that you could tap into, well, I don't know, Amazon or any other people and see what's there for the taking, Wikipedia. There was no such thing. The most you had was a good library and the best references. You had to be on your toes. I remember once I was at the department and one of the ministers, one of the junior ministers, got in the lift as I got in. Oh, Mrs. Ishmael, she said, I'm so glad to found you. I'm on my way to go and give a talk on occupational health nursing. How many occupational health nurses do we have? And as we step out the lift together, I was able to give her an approximate amount of the total. I had to be able to tell her what they do, how they work. In other words, the briefing on the go was, you had to pull it out. You had to put it out. Years later,
That walk in the corridors.
that walk in the corridor and just checking. I can imagine walking the corridor to get it right and making good relationships. I always say to people I know, make a friend before you need a friend.
That's a very
You live by that. Make a friend before you need a friend. So you made friends with the ministers, PAs and secretaries. You made friends with those who you might need to call on them when things are not going as well as you hope, and be able to give the right answers. There's something in numbers and data and knowledge bases. If you can get those right, if you know the latest and not give the out-of-date answers to questions, nobody forgives or forgets the person that gives the wrong information about something that has ceased to exist or is no longer feasible. So keeping a top of developments and news and what's going down, what's not going down.
Yeah, and of course, certainly reading the policy.
Absolutely. There's such a thing as big P politics and small p politics. The small p politics is the workforce and getting on with it. But the big P, you better not call the wrong thing, individual by the wrong designation or name. You do need to know what's going on.
Yeah, absolutely. But when you think of some of the roles and responsibilities now around nursing policy and that broader challenges, as we would now talk about equality, diversity, and inclusion, and
Yes.
the influence that you had in many of those major meetings, could you talk about that and maybe some of the insight that you gained from the questions as much as the answers that you gave?
Yes. The 1994 Chief Medical Officer's report mentioned for the first time Black and ethnic minorities. Previous to that, when I was at the department, people like Baroness Cumberledge, who was a junior minister, has set up a group looking at what chief execs could do to help Black people in their under who they looked after, and BME nurses. In fact, I remember when the term BME was coined, I was part of that group who helped to come up with that term. Somebody needed to bring it down to syllables that people could understand. I know it's not on to be called a BME person, is probably to feel an insult, but no, Black people and and Asian people. Somebody tidied it up in the civil service world to BME and then BME. However, when that two lines of his report mentioned Black and minority ethnic people, it gave us, if you like, the right to call out what the services were. We were mentioned in dispatches. And from that, the ethnic health unit led by the late Lord Chan was formed in the Department of Health at the time in Leeds. A lot of work went on to get publications for people to see what was happening. It was a slow task. It still is. It was a recognition, striving operation. How do we get Black and ethnic staff to be recognized and patients to be served?
Yeah.
What services could be laid on? What statistics were saying? How could we change the narrative of that time? It took work.
And of course, that And that was before Positively Diverse, wasn't it?
Oh, Barbara,
Barbara
Barbara
Burford.
Burford in her time. She did such good work in Bradford. Her work was so seminal that the Department of Health took over the title, took over her work, and moved it forward. Barbara Burford was a trendsetter of no mean order. She changed the narrative again. She got us to think differently about services for patients and people and for staff. Recognition is due, and she must be remembered.
She must be, and Positively Diverse was at the center of our
Yes.
Connect.
Yes, indeed. Yes.
Policy-wise, was based on what was set out very clearly in that work.
Yes, a lot of trusts and departments model their work on the work that Barbara laid the foundations in Bradford.
Yeah,
Mhm.
really. She's definitely an unsung hero
She is.
in that whole servant leadership that we talk about again.
Yes.
On the Windrush Generation,
Yes.
from the Caribbean community. And I think what's important, and you're highlighting today, Nola, is the fact that Caribbean nurses, such as yourself, even though there's not a great numbers, but you had an impact within the system itself.
I took it upon myself.
Corridors.
Yes, I took it upon myself when I got to the Department of Health that I would start a mentorship program, a shadowing program. I invited people to come and see what was going on at the department to try and understand the relevance, the necessity of knowing policy. When a new policy came out, I would say, read chapter this, look at that, apply that to daily work, taking it from just something to speak about to activity. How many nurses do what? How many people benefit from? What's the evidence to show? How do you collect your stats? What do you do with the information? And how many unsolicited reports have you written lately? Why wait to be asked?
Absolutely. And again, and that brings us to the whole area of personal development.
Yes.
And being ready to lead because you've taken the initiative.
Prep yourself. See yourself in the job you want, not on the day of the interview, please. But imagine you are. I remember one of my mentees, I have them, you see, really, there are a lot of them. One of my mentees rang me to say she was going for an interview, and we went through the pros, the cons, and what might make an impact, and how could she be remembered from the lineup of other applicants. And this is what she did. When she went to the interview room, as she sat in the chair, she looked at the panel after saying good morning or afternoon, I wasn't there, and she said, I want you to imagine that you have appointed me to this post. These are the 3 things I would do in the first 6 months. And she led the interview with her vision, with her capability of how she saw herself in the role. I needn't tell you, but she got the job.
Absolutely. And that's a good lesson for today.
Yes, vision yourself. Envision.
Excellent. I know also that you had, or you were involved in the establishment of the Mary Seacole Leadership Awards.
Yes, indeed.
So can you talk about?
Yeah.
Tell us about.
And when I got to the Department of Health, John Major was the Prime Minister. And from all accounts, he had gone to an event the Windsor Fellowship, that was called then. It's now the Windsor Leadership. And the bishops of Ireland and Wales was present. And they lobbied the Prime Minister, the then Prime Minister, about Mary Seacole, saying she should have some recognition. Mary Seacole was hardly ever mentioned before. So he came back and gave it to the nursing department, to find out what could be done. And part of that job fell to me. We had to look and gather information about Mary Seacole. Connie Marks, who has now passed, was then the president of the Mary Seacole Association. And she was tremendous. She let us have documents like Mary Seacole's will and all the information that they had gathered to help us to inform our provision of information for the Prime Minister. And so we wrote the paper that went to Downing Street, and it was decided that some funds would be found to create a memorial for Mary Seacole. It wasn't clear whether it would be a one-off payment or what. However, we were allocated £250,000 from the Department of Health to produce a leadership program in the name of Mary Seacole. Nestlin Watson jury received the check, and we got ready, we set up a reference group and had the first scholar by 1995, David Salah.
Yeah.
At the time, the award was 25,000 to the one person. I know it has now progressed, and we have a number of people benefiting from this award, and that the funding of it has moved across to different organizations.
I mean, there was a point where the RCN were the administrators.
Absolutely. The RCN, the RCM, the Health Visitors Association, Unison, and one university per year was part of, I think it was University of Luton at the time, was part of the group. But we had a management, and in my time at the department, I was privileged to support and mentor 10 scholars of the Mary Seacole Award. And it's nice to see people like Professor Laura Serrant, who was one of the winners, early winners, Gina Higginbottom, who was another Mary. It was good to see how the progress has got on and keeps going. Mary Seacole Award was part of the backbone of leadership in the NHS.
And of course it had a research base as well, didn't it? In terms
Absolutely. You couldn't get it just because you asked for it. You had to have a project that involved BME services and your development. Yeah. And I'd like to think it is still doing that and doing a very good job.
And in fact, what it did do, it set the model for the various other leadership types.
Indeed, yes. It was like, what do you do? How do you develop people, Black nurses, and why should you do it? That was one of the questions. Why? Why not? Yeah. It's important that we keep the talent that we have and develop that talent. It's no good just saying, oh, she's good at what she does. Maybe so, but could she do better? Could he do better?
We're always wanting system performance.
Absolutely.
Quality of service, quality of care, again, improvement.
All the way, yes.
So I also know that you had a hand in getting on against the odds and many rivers to cross as well.
Absolutely. Now, getting on against the odds. 1999 nursing strategy, making a difference, had 8 chapters in it. And 8 nursing officers were given the task of developing each chapter. And the one who had the one on developing staff, there were no mentioned and nothing was being done about BME staff. So it was decided, let's do an inquiry. Let's look and see what is really happening. This was just before the millennium, 1999. I had gone to the Department of Health in 1994. And before that, in 1992, I was part of Baroness Cumberley's working group. But now looking at what has happened and the very fact that BME was being mentioned, and the lack of progress was now coming up as evidence. People had been in the NHS with histories of working for 25 years as a staff nurse. Disgraceful. And they were the ones who taught the next promoted person. And what was happening was a level of bitterness from BME staff and resentment that they were never identified as bright enough, as good